Okay, we are live.
Hi, good morning.
Tell us your name, please.
My name's Emily.
Emily, and you're a nurse practitioner.
Family nurse practitioner. Yes.
All right, tell us the things that you've seen and the things you want to tell the world about. And thank you for doing this.
Oh, thank you guys so much for what you do. Thank you for hearing voices, hearing families and lives. Throughout COVID, a few colleagues and my husband asked a lot of questions, especially about the shots. And I can just tell you, into COVID and the shots specifically, a few patient stories that stick out so much are just how lives have been changed. These lives have not been lost, but specifically one woman who's actually had 4 shots because she kept being recommended to continue to have booster shots and get vaccinated to prevent COVID, but she kept getting COVID. And she had such severe neurological issues, they thought she had stroke after stroke after stroke, but nothing would show up. And so then she was just being told she had psychological diagnoses of all the symptoms. And she's her life's been flipped upside down. She was working mother, and she's had to completely change her life around, career, out of work for a couple years related to just the injuries that she's suffered, different medications, and again being passed around different specialties and providers because she just was told it's all in your head, it's all in your head. There's no way these shots have done anything to you. So just trying to help protocols that Children's Health Defense has also helped me with as a provider, and other groups, FLCCC, who are amazing providers trying to help patients through these vaccine injuries that have been so devastating. Another similar gentleman working, the main worker for his family, and after his 3rd shot had such horrible neurological issues, has been out of work for months and months, and again been through all the specialists, cardiologists, pulmonologists, told there's nothing wrong with you, but yet difficulty breathing and difficulty functioning mentally, and still has had COVID several times after the COVID shots. And so just being told, just keep getting the shots because this will help prevent you from getting COVID. So just trying to help support patients and talking through what they've been through and validating that these shots have drastically changed their lives and help support them getting back to a functioning state of being, fathers and husbands and working jobs to support their families. Has been really, really devastating.
Do you feel that the whole COVID era has been a massive education for you?
Absolutely. Yeah, I've tried to question things in the healthcare arena since becoming a nurse first, and then a provider as a nurse practitioner. I always wanted to question some of these protocols of why do we do certain things, this and that, even vaccines. But then when COVID has hit and just the shutdowns and especially the push for shots, whoa, wait a minute, what are we doing and where is this coming from, and how do we know it's safe, especially the safety of so many things in the healthcare arena right now.
And it's affected this beautiful child here because he's doing really well.
He's great. He's the youngest of 3. His older siblings have had vaccines, and so we became better educated on what are in these vaccines. Why do we have to have so many for our children? He was born in 2020 when everything was hitting, and we started to really ask a lot more questions about vaccines and look and see at the devastating effects of how many people are negatively affected by these vaccines, that we support their immune systems to try to fight off if he got measles or mumps or chickenpox. So just a lot of questions of why.
So we hear a lot of stories like this of people in the medical profession really waking up to the whole thing during COVID. So really it's backfired on them, everything that happened in COVID, because people like you are now questioning and not vaccinating your children.
Right.
Taking a different turn.
Yeah, right.
How do you feel about the training that you got given as a nurse, pushing the vaccinations? They didn't tell you, did they?
No, and that's what's so crazy is definitely looking back at the education, both of undergraduate and nursing, and then becoming a provider, and just thinking, how were we educated on vaccines? And we never were. We were just told, this is what you do, this is what people need, this is what prevents illness and prevents death. So everybody should be vaccinated. It's public health. It's what we do. But never how they work, where, when they were made, how they're made, how they truly work in our body down to like the cellular level. What are they doing when we get all this injected, and what is exactly being injected? None of that education for sure, which has now come about, which I'm grateful, right? You take the pros out of devastation, of all the devastation with COVID. We're so grateful to be learning so much more about health in general for our children, for me, for my patients, and just trying to help learn more.
Is there anything else you want to tell the people?
Just I would love to validate that, especially the shots, if you've had the vaccines, they have caused a lot of issues, and to please reach out for help, because there is help out there, and to keep asking questions and feel empowered to question your healthcare provider, to question and ask why and ask how, because I think it's a great conversation to have for sure.
Thank you so much.